Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates.
Hello everyone, I'm Katie and I'm one of the hearing care assistants here at Audiology Associates.
We've got two patients in this compilation. First patient is mine, second patient is Katie's. You will see Reece soon. I know he hasn't been on for a little while. He'd be probably fed up of seeing myself and Katie. But this is my patient first. We've got what I thought was going to be really soft wax to start with, like a really soft plug, which actually turned out to be really, really dry, which was, kind of caught me off guard a little bit. So I've got, this is the rye curette, which is pretty good for these little ones with little gaps at the top because it's kind of curved slightly, which is perfect. Done a smashing job there, Neil. Fair play to you. What I'm trying to do is not put too much pressure because I don't know how far this plug is going in. So I'm just trying to just gently pop it into the top, just kind of give it a little pull, see if we get any movement, which we do manage to get like little bits coming away. But I don't mind doing these ones. These can be quite satisfying.
It's quite nice going in with a manual tool sometimes. I had a patient earlier and it was just, like I thought section would get it out, but I just went in with a manual tool and it was just a scoop.
Yeah. Oh, especially when there's plenty of space. It's difficult when the patient's got quite narrow and bendy ear canals. It gets a little bit more awkward then, but when the ear canal's nice and wide, you've got plenty of room. It's quite nice to, remove it with manual tools.
Yeah.
You'll kind of see now it's almost like unraveling. So there's a lot of dead skin in this ear canal. Now I think we do swap up to a set of forceps, I would say. I'm again just brushing along the surface of that skin there. I wanted to see if there was much give. So we're gonna just gently get a good grip of this plug here now. I'm just gonna lift it.
That's just a trail of dry skin, is it?
Pretty much,
Okay.
pretty much. But it's going to come away in little sections, which is fine, it's better than nothing. But yeah, this is a
tough old bit.
Yeah, it's a tricky old piece of wax, this one, and skin. It's like all connected in one. There we are. It's all going to come away now. We've got a good grip.
It's hard as well, though, because like obviously you want to just pull. So you've got to be so careful.
Yeah, we do get, we get patients. We get, people in the comments saying, "Oh, why don't you just get it in the end and whip it out? It looks nice." It's not as easy as it looks. It's anybody who's tried this and has found it difficult, like realizes how tricky it is to keep one hand really still and do your job with the other one. As well as avoiding the ear canal. It's like a game of operation.
Literally.
It's a difficult one. Unless you've had it done yourself, how. I wouldn't say uncomfortable, but if it's not done correctly or if it's rushed, you may be in quite, significant discomfort when it's being done. So we have to take our time. We always. I know we've mentioned it a few times, but we have to put, patients' safety and you've got to keep them comfortable as well. That's the most important thing, really. So we got the round head Jobson horn this time. I've gone for something a little bit thicker and a bit more sturdy now, just to get more of this out. You can see it's still drawing down. There's still quite a lot of this coming out. It's literally like Mary Poppins bag. Pulling lampshades out of it.
So that tool you just went in with for that's the one that is like at an angle, isn't it?
The round head one?
Yeah.
That's the single Jobson horn. It does have a little bit of an angle.
So
it's straight and then it just kind of dips a little bit on the end. Look at that piece of skin there. It's a good one. Enjoyed that one actually.
That's mental.
Last little tiny bit there now. Take this little flake away. And there we go. Tiny little bit on the side, we're not going to worry about that.
No.
Yeah, that's
not
perfect.
causing any issues anyway, is it?
No. This is the same patient, but it's the other ear. Now, you could see completely different consistency. Very, very humid. what we've actually done here is I've already irrigated this slightly because I could see how wet it was, which is why the camera steamed up. You tend to find if you hold, when it's quite humid, you hold the camera in the ear for usually a few seconds, and the humidity, the steam tends to kind of go away. But it wasn't really doing it. It was just kind of staying there.
But sometimes if it doesn't, because obviously I've irrigated patients before and then needed to do suction, I just go in with a suction tube like you said before, and just try and draw that humidity out a bit. You may. I mean, a lot of people are actually quite comfortable at having that done, but you may find with that sudden temperature change, it can sometimes cause a little bit of dizziness. So I wanted to avoid it if I could, which is why I'm going in with a standard tube here now. I a very, very poor view of the eardrum there. Sorry guys, I couldn't get, without me using suction, I couldn't get a real clear view of the eardrum, but we managed to clear it. Patient was hearing better. And that's what we removed. That was probably, I missed the ruler then, it was about 4 centimetres. I think. Good job, he was looking. This is Katie's patient now. Ooh, that's a wet looking. Very, but only the first initial sighting of it was, as it was getting removed and coming away. It was coming away quite easily, to be fair.
Oh, yeah.
Didn't really struggle too much with this, but as Reese have just made myself away, I actually removed it from down in the anterior recess. I know.
Look at you.
It's a proud moment.
Yeah, I see.
Getting it.
You don't know your skill.
No.
You don't know your skill.
It's literally like you just said, like having that steady hand and just having that confidence. But obviously, not all patients I've done it with, because I also always know my limits as well.
Yeah, that's good.
Of what I'm capable of doing at this moment in time.
That's what it's all about.
But
patient would much prefer you to be, safe rather than just.
Oh God, yeah.
Going in there and just,
Always got to put the patient first. Do you know what I mean? I don't want to be going in there and just be like, "Oh, sorry, that's your eardrum."
Hey, take that away. Don't need that.
But it was actually coming away quite nicely, and I'm still not good at them shots, guys. Sorry about that.
Don't worry about it. Quite deep. Look at that.
It was just always like just a piece after piece. I thought it was all going to
narrow as well.
Yeah, I have had a couple of narrow canals. It's surprising because obviously when I do the first otoscopy, I always lift the ear. But then when you go in there, when the ear's not lifted, it's like, oh, I haven't got much of a sight.
Yeah. You will probably find at some point as well, you'll get some ear canals where you just need that third arm. Just need that third hand. So sometimes if the patient is able to, we do get a couple of our patients to actually reach around the back and pull their own ear back, which again just does really help to get it out a lot easier. We don't do it very often, but no, fair play for a deep one. That was a good job there, to be fair.
Exactly the same, both sides.
Oh.
But yeah, like I said, they both come away very easily. Same consistency as well, which was good.
Good.
But this actually, I think this canal was a little bit wider. No, the first canal was a little bit wider, sorry, because I struggled a little bit initially to get this one out, because I think it was just held on by a bit of skin by there as well.
Yeah.
Which wasn't in the other ear canals, but it's slowly coming.
I say you've always got to get those tricky ones.
Yeah.
You've got to get those tricky ones so you get kind of used to doing them.
Yeah.
Sounds really.
It's the only way you're going to learn, really. It's practice, isn't it?
Yeah, exactly.
Because since I've been, actually qualified, I think I've only done about 70 patients yet.
Oh, is it?
In comparison to how many do you think you've done?
And you want to know? Thousands. Yeah, I don't even want to know how many Reese has seen it. You've been doing it about 10 years longer than me.
Lots.
Yeah,
lots.
lots.
Quite interested to get a rough idea of how many patients you actually have seen.
We roughly worked this out, didn't we? Recently, how many people we see a year each? We see about 12 a day, don't we?
Yeah.
Roughly.
Thereabouts. 12
patients a day, so that's not far off 1,000 a year, isn't it?
Yeah, it's probably 60 a week. So 52 weeks, 3,000 patients probably if we're offering for every week. Yeah, probably a good couple of thousand.
That's bad.
Good few thousand, yeah. See, look, yeah. We're Not all heroes wear capes.
They wear purple squibs.
Yeah.
Are they purple? Burgundy? Burgundy.
Yeah, I call it burgundy.
But yeah, because I did have a bit of trouble with this one. It was just a lot more drier, a lot more solid, which I didn't expect, to be honest, because the other one was just so easy.
Oh, you'll always tend to find it, and guaranteed the patient probably said this was their better ear as well. It's always the better one that
always
takes longer to do. But no, like I say, you're taking your time. You know, you're not rushing it. That's good.
No. But I do get it. I think this is the one where it was down in the anterior recess. Because I wasn't going to do it to begin with. Because I thought, it's a bit close.
Taylor! Or Reese!
But no, I managed to get a good view with the camera. And it was, the back end of it was close to the eardrum, but...
That needs to just be lifted in now, and that looks like it's going to come loose. Oh, go on. Oh, they're frustrating there, aren't they?
I know. It was just patience, that's all I needed, to be honest.
It's tricky because you'd say, oh, I could have put a little bit of oil in to try and, get that slipped out a bit easier, but then again, that's going to, slightly obstruct your view a little bit. It's a tricky one. Yeah,
I'm still getting used to using the oil, to be honest. It's just like remembering that it's there.
Yeah.
Obviously,
so many different
if
things.
the patient's used it,
but see the eardrum now poking through, look.
I don't know whether this comes away as one whole piece or it breaks away a little bit. I can't quite remember.
That looks like it's all going to come out.
It does. I think it does.
Ooh, shit, it comes.
It's like, come on.
A bit of oil on the camera. This is what happens when you get oil on the camera. It kind of like bubbles and you don't see anything.
Yeah, just
look at that.
Blocks a bit of vision, really, like it did right there.
Oh, that's a good job. That was. Look at that.
It's a little bit left, and this is where I thought. So I put the fine end on. I thought, because that's very deep, I'm not going in there without that fine end. And little bits that I thought, do I get?
I still struggle with some of those now, to be honest. So that's a job well done, to be fair.
I think I was lucky with this one, to be honest.
You're not lucky, it's your skill, right? You're not guessing. Back yourself.
But I was just like, right, camera in, scope, camera.
No, that's good. Look how steady you are. That's good. Oh, that's a tricky one. Look how deep that is. That's.
But I looked at the consistency of it first, and it looked like it was wet and consistency, so I could get the grip.
They either go one or two ways, these little bits. They either come away in little tiny bits, and it always leaves a little bit down in that deep recess.
Yeah.
Or the whole thing comes out in one go, and it just lifts as one big plug.
And then you can breathe and go,
Yes.
But it's coming away now, and I thought, go on.
It's always,
it is.
Yeah, it always kind of puts you off, because you never know how much is there until it starts lifting. Like that's actually quite a big piece for that, for that little area. But look at that. That's what's that? 3-4 centimeters? Just under 4 centimeters.
Just under 4 centimeters, and is
inch and a half.
I don't know the inches.
Inch and a half, I think.
But I was pretty proud of that one.
Yeah, that's a really good one. Well, guys, thank you for for watching the video. If you do like the videos, as always, don't forget to like, heart, share, follow, subscribe, and you can become a member if you're really interested and really love the videos. We do basically post every day of the week, so you will get extra videos as a member. And when the time eventually comes to it, we do interact with the members occasionally on live videos as well, which are members only. So anyway, don't forget to take care of yourselves,
take care of your ears,
and take care of one another, and we shall all see you on one of the next videos. Thanks very much, guys. Bye bye.
Thank you, guys.